I'd say it's different based on whether you want to start the conversation with a partner versus a healthcare practitioner. I think with doctors, it can be really useful if you write notes down before an appointment to remind yourself to talk about it. I also recommend you can just pass your consultant a note. I've had people just like write sex question mark on a sticky note and then just hand it over to their neurologist or MS nurse, and that is a good way to open the conversation. You can also just like say that you feel uncomfortable. I think acknowledging that people find it awkward or a bit funny to talk about is okay. So you can just say, I feel really weird asking you this question, but I've noticed I don't have a lot of sensation when I'm having sex with my husband anymore. And the more you practice that, the easier it gets. Even if you just practice saying the words out loud before you go to your appointment can be really useful. If you're trying to open up a conversation with a partner, I think same thing applies. Set aside time where you can talk about it. And again, just acknowledge like, this feels weird. We've not had this kind of conversation before. Can I talk to you about sex? Like things aren't working in this way. But again, like practice makes perfect. Yes, so sex is obviously a lot of physiological stuff, a lot of biological stuff, but then there's a huge mental component. And the way we conceptualize talking about sex is we're saying, one, is there like basic biological functioning happening? And then two, what's going on in your mind? Do you feel like you want to have sex? So if your body is getting aroused, do you feel psychologically aroused? So psychosexual is just acknowledging that we have those two parts, those two components, and we try to work with both of them when we're treating any sort of sexual difficulties or sexual dysfunction. So psychosexual therapy is a service that, again, is like linking the mind and body. So it's specific to sex, unlike the way normal psychological therapy would be. We have specific techniques that we've developed to do with couples or to do with yourself. We will recommend more specific tools for masturbation, let's say. We will often link up with other services that can prescribe medication or can refer to gynecology or urology. So the whole point of it is that we are targeting the biological and psychological issues that are going on when you are having sex. And I think it's a really useful tool because we have such specialist training in that area compared to other psychological therapies. I think we have rates about 50 to 80% of people with MS experience some sort of sexual problem. What I think is really important is that when we're doing psychosexual therapy that we take into account that they have a long-term condition, because I think general psychosexual therapy doesn't really acknowledge that there are other processes that might be going on because of other diseases. So I think people with MS can benefit a lot from going to a provider where they can share information about how MS affects them. So for example, loss of sensation, which you might not usually see outside of people who don't have MS. I think it would be really helpful to address a lot of the psychosocial factors that are going on. So obviously when you have MS, diagnosis can change your identity. It can change your relationship with your partner. I feel that a lot of people have an issue where their partner becomes more of a carer. So doing some sort of couple psychosexual therapy could be really beneficial. And also having regular check-ins about how is sex going for you now? What can we try that would be different this time? What kind of sex toys can we use? What are the parts that you feel like you're missing? Is it the intimacy? Is it the sex? Is it the orgasms? And then having somebody who can advocate for you as a psychosexual therapist to other services. So to write a letter to urology saying, can you please prescribe X, Y, and Z things? Or would you be able to assist somebody with managing sensation levels, whether it's too much pain or not enough sensation at all? It depends on why the libido is reduced. So I think a lot of times if it is more of a psychological block, like I just shouldn't be having sex, then there's this difference between spontaneous and responsive desire. Spontaneous is that stuff you get like at the beginning of a relationship when you're in the honeymoon phase where you just think, oh my God, I really want to bang this guy, right? And that happens a lot, maybe for the first 3 to 6 months, and then it tends to, kind of gradually go down. Responsive desire is when you want someone to make the first move. And that's what tells your brain, okay, maybe I do want to have sex right now. So being open to that is really important. If you have a fear of sex where you start to avoid sex, it almost closes off the opportunity to show that responsive desire. So people who schedule sex tend to have better relationship satisfaction and better sexual satisfaction. And I'm not saying, schedule at exactly 2 p.m. I'm going to put my penis in your vagina, or however you're going to do it. It's saying we'll have alone time around this time on a Friday, and we'll make sure that we can be intimate. And if sex happens, great. If sex doesn't, that's fine. I think a lot of the issues around desire have more to do with the phobia of engaging in sex or the avoidance of sex. And avoidance just breeds avoidance. It's like the number one thing we're trying to correct when we're talking about psychological therapies, whether it's phobias of spiders or feeling afraid of how sex is going to feel with your partner. That's how I would approach it. Sex is obviously really physical, so it requires a lot of work for the most part, and there's a lot of accommodations that we can suggest. So it might be positions, for example. One thing that we'll often suggest is to try sex positions just with your clothes on. So just be like, for the next 10 minutes, we're going to try different poses, and you can say, this is more feasible for me to hold, this is less feasible for me to hold, to figure out what feels better for your body. You can also pick certain times of the day where you might feel less fatigued to engage in sexual activity, whatever that might look like. Sometimes it can just be like if you have a cup of coffee before sex, it can help a little bit. But also we just try to scale back what we are thinking sex to be. So it's not just like vaginal penetration. It's more about what do you need to feel like you are having the kind of sex that you want to have. Maybe that just looks like you're kind of lying next to each other and you're just mutually masturbating. That's totally fine. Sometimes I have people that will watch porn together and they'll kind of do that. So it's low effort in terms of like physiological effort that you're exerting. And that can be really useful. So planning things around the times you feel less fatigued, changing positions to help manage the amount of physical exertion that you're having, and then finding different kind of sexual activities that require less sexual effort or less physical effort so that you can come out of sex feeling like you've had a nice time, not that you need to sleep for about 10 years. Talk about it. I know that's like way easier said than done. If you feel like it's impacting your relationships, I think there is a role for telling your MS nurses or your consultant that you are having problems in that area. But the best thing you can do is just sit down with that partner and say, look, I'm struggling in this way, whether it's because you feel like your body has just changed. So people will often say, like, I feel like my body is turned against me. How can I possibly have sex if my body doesn't work? If my body kind of hates me? Explaining to your partner what's going wrong can be really useful. There's a lot of touch exercises we'll recommend to get people to feel in their body while not focusing overly on pleasure. And I think having a partner to help do that with you can build a lot of connection. But unfortunately, the answer always goes back to communication, right? Are you talking about what's going wrong? What do you need to help facilitate that talking? There are tons of resources online about kind of questions you can ask your partner. I think there's apps now that I see about relationship check-ins and how to monitor how things are going for you and what else you feel like you need to feel like you are living your best sexual life, because I think that's something people just don't consider enough, especially in MS. Definitely. So the benefit to psychosexual therapy is that we are looking at psychological aspects, obviously, and sex bleeds into a lot of areas of life. Shame is a really big one that we work with. Also anger, so feeling anger at your body, feeling shame around sex, sexuality, shame about what you like, shame about what you don't like, shame about how often you want to have sex or don't want to have sex. Fear as well, so fear of different kinds of relationships. Fear of dating comes up a lot because people with MS often get diagnosed when they're in their 20s to 40s and maybe they're dating. How do they disclose that? So we look at a lot of different levels of your overall well-being. We treat it as sex is part of your well-being and should be a main factor of your quality of life if you want to be having sex. So we absolutely deal with all of those kinds of issues. It's almost like we have this background of psychological therapy and then we just make it more specific to sex, but we find that it always deals with all of the other emotions because they will find one way or the other to come into the bedroom.